My office today is absolutely beautiful. Outdoors, beautiful skies, sunshine, a little bit of breeze. So we're just going to have a little intro with the team. Let me start with Rhonda because you're my connect person. Rhonda Friday, good morning to you.
Good morning, Carol.
So what can we expect this morning?
This morning we'll be visiting basically a number of businesses in the Warrens area, and we want to connect with staff and the workers in and out of businesses along the road, just to tell them a bit about the National Workplace Wellness Policy. We're trying to sensitize persons about it. We've just finished a whole suite of infographics and promotional items on the policy. So we really want to get out to the businesses and so on to let them know a little bit more about what the policy is about.
All right. All right. So what I'm going to do, I'm going to jump over to Professor Devnish, and then we're going to introduce the rest of the team. So this is something that is very important, probably to you because of what you do. How important is it introducing something like a national wellness policy in businesses and workplaces?
Hi, Carol. So this is an extremely important initiative. In 2016, Orlando Gabby Scott brought the idea that we should really investigate whether other countries have a national workplace wellness policy. When I did the investigation, we found that there was no country. And Barbados in 2019 was the first, through cabinet approval, to have in place a national workplace wellness policy. And what a national workplace wellness policy does is that it provides the strategic guidance for employers in the private sector, in the public sector, in the NGO sector, on how they can promote wellness behaviors in their workplace. And the good thing about this policy is that it doesn't only touch the physical side. It goes through the environmental, the mental, the psychological, all various dimensions that make up the human condition. And I think the other key thing about the workplace wellness policy is that in light of our NCD burden, in light of our health crisis, not just in Barbados, in the wider Caribbean, I think we need to get on to promote wellness across the board, because you could have a situation where people are doing their wellness journey at home in the communities, but then in the workplace they're stressed, they're leading sedentary work styles that are not promotive of wellness. So we need to get people on board on this initiative.
Again, and yes, we're in the heart of Warrens, and with me today we have Shakira. We would have introduced her a little earlier, but if you just joined us on VOB 92.9 FM, we're talking about the Barbados Workplace Wellness Policy, and Shakira is a part of the Barbados Workers Union. Why is this so important?
Well, Carol, the first thing that we always have at the Barbados Workers Union is that we often say people are people first and then workers second. And when we are talking about a national workplace wellness policy, we are trying to look beyond the regular safety and health issues of incidences, accidents, and near misses, but we're looking at the whole person and the health and well-being of the entire being. So you would have people going to work day to day, you don't know what their challenges are, you don't know what's going on at home, there may be stresses at work, it could be interpersonal relation issues, it could be environmental issues, it could be physical issues, or just simply not happy and a low morale and so on. And we're trying to encourage companies and get the buy-in as well from the Barbadian public to see the importance of looking at people as an entire being, so that we can understand that people can produce more once they feel happy. People would add more to our society in any different way that we can think of possible when they are well and when they are healthy, from a psychological perspective as well as a physical perspective.
Is there any particular plan as to how you're going to help continue to push and promote this among your members at the Barbados Workers Union?
Definitely, and the first step to that is education and awareness, helping people to understand what exactly is wellness and what the policy is about and what it speaks to and how it benefits them as a people. And the next step from that is not only to educate our members, but also to educate the employers, to educate other government departments, to educate Barbados on a whole, so that people know what it is that we're talking about. Sometimes we go through things and we don't know that there's a name to it. We don't understand that there are challenges that we are facing, and these are things that we are aware of, and we need to deal with them, deal with the root causes, and no longer hide behind the taboo subject of psychological wellness or mental wellness, but let people know it is okay to talk about these things. And I think that's the one thing that COVID has done for us, is to allow for us to understand more that the mental health
We are still in Warrens, and that is where we stay this morning. But just heading to different businesses, we're at Saul Warrens, and we're talking about this workplace wellness, Barbados Workplace Wellness Policy, and the fact that it is there, and many people may not be aware. A lot of workplaces do have policies in place, and with something like a gas station, a petrol station, for safety, obviously they would have some policies in place. So I am here with one of the managers of Saul Warrens, Kerwin Scantlebury, and of course they do have some policies in place, but we're going to tell him a little bit more about this workplace wellness policy. Good morning to you, Kerwin.
Hi, good morning.
Good to see you.
Good to see you as well. Thank you.
Saul Warrens and the things you do to help keep your staff in general safe. There are some policies involved there.
Yes. We have, we check a lot on mental wellness, and also we make sure, everybody has on the right shoes, make sure, they have on the reflective jackets every day, because, you got to make sure they're safe, because there's a pretty busy place, and, you want everybody to be good.
This is probably one of the busiest gas stations in Barbados.
Yes, it is.
My goodness, constant traffic. So which means that with your staff, they probably have, because of the very quick turnover, sometimes they can feel a bit overwhelmed. So let me jump in here. Professor Dwayne Devonish is here. So Dwayne, let's talk to Kerwin here. We're on first name basis, VOB. Don't worry about it. And some of the other areas that the wellness policy that we have in place can help Saul and other companies really push and assist their employees a bit more.
Yeah, thank you, Carol. And thank you, Kerwin, for sharing a bit on what Saul is doing when it comes to wellness. Now, the National Workplace Wellness Policy also covers areas outside of health and safety. It deals with mental health and stress management. It also speaks to looking at your work environment and making sure that it's safe and it's tidy and it's well organized. And it also focuses on morale, which we call social wellness and communication and so on. Are you aware that Barbados has a national workplace wellness policy?
Well, to be honest, no, I'm not aware. I'm very surprised, and it sounds good, but I'm not aware.
How do you think that this could assist Saul and you as a manager?
Well, it's a high stressful environment and job, so I think it will do very well for this particular environment.
So how can you help Saul and other companies really get into this national workplace wellness policy and gets parts of it moving, because everything takes time?
You're absolutely correct. And wellness requires an expertise. Carol, I sit on the subcommittee that reports to the National Committee on Workplace Wellness, which falls under the Ministry of Labor. And one of our deliverables is to work closely with managers like yourself and your staff to develop the workplace wellness program. So you don't have to do it by yourself. You can actually reach out to us. We'll leave our contact information, and we will come into your organization and give you training, give you consultation and advice on how you can improve workplace wellness under the policy.
Well, I'm going to put Kerwin on the spot. Make him. Oftentimes as employees do have challenges, and you're an employee in your own right, but you're in a senior role. What are the kind of stresses that managers like yourself go through and you're not able to share with your employees and the people who you help to supervise?
Well, you have to, it's kind of like a sandwich. You're kind of in the middle. You're between the directors and the higher beings, and then you're between the staff. So you're trying to make everything work. So it's hard, getting people, especially in this environment. A lot of people under a lot of financial stress, relationships, homes, children. It's hard. So it's hard trying to get everybody to do everything they need to do. You got to give a little lack sometimes. People have different things going on, so every day might not be the same. So you got to work with them on a day-to-day business. Come in, try to find out, what's going on with you today. How's everything at home. You got to have a little empathy, and it's hard doing that for a lot of people, but that's the job.
What I'm hearing is balance.
It's a very hard balance, but you have to try. And with this initiative, I think that will help us a lot.
Well, there you go. That word balance, how important is that as it relates to this national wellness policy?
It is absolutely paramount. At the heart of the workplace wellness policy is the assurance that workers and managers can have a balance between their personal life and their work life, and that one does not spill into the other. And we've seen that in the height of the pandemic, where people's boundaries between work and home completely disappeared. So it's about restoring those balances and, of course, those boundaries.
So Kerwin knows about it now. The SOL team at Warren's knows, and I'm sure Kerwin will be sending on to his directors, hey, here's something that we can possibly implement. If people are interested and listening, it could be employees who would say to their employers, hey, let's look at this, or someone who runs a business and thinks to themselves, no, this is something that could possibly make my business even better because my employees would be in a better state of mind and physically as well. How do they reach out?
Right. So we have a subcommittee for promoting workplace wellness, and this falls under the Ministry of Labor and the third sector. So we're asking employers if they're interested, they can check the Ministry of Labor. And you can check Rhonda Farley, and she works in the ministry and she's responsible for that unit. We also have social media handles that you can contact us. Workplace Wellness BB, that's our Instagram, and you can check us at National Workplace Wellness in Barbados on the Facebook handle. So reach out to the Ministry of Labor, Rhonda Farley, or even myself at the university, Professor Dwayne Devonish, and we can let you into the business of workplace wellness.
Okay, well, Professor Devonish, he has to stay. Kerwin Scantlebury, manager here at SOL Warren's. Thank you so much for taking a little time.
Thank you both.
Thank you.
All right, so we're going to take a little break, Ronnie, and move on to our next location. Yes, we're staying here in Warren's, but we are moving to another location. All right, so Donna is with us from the Ministry of Health and Wellness. Let's talk about the role that the ministry is playing in this policy. And poor Gabby, I'm stressing out Gabby with his son. Let's see if we can reach a compromise. Is that good? All right. See, making sure that my colleague is well, physically and emotionally. That's what we do. Tell me about the Ministry of Health and Wellness and your role.
Good morning, Carol. Well, the ministry in 2018, the name of the ministry changed to Ministry of Health and Wellness. And through that, we have a wellness initiative or wellness program in the ministry where we promote the dimensions of wellness. And in the same way, the National Workplace Wellness Committee promotes the dimensions of wellness. So as a representative of the ministry, I sit on that wellness committee, the Workplace Wellness Committee. And as health promotion officer, senior health promotion officer, I sit on the subcommittee that represents promotion and awareness. So we are about promoting what wellness is, the different dimensions of wellness, how this is important in terms of reducing risk. For example, reducing risk of non-communicable diseases, helping persons to cope and perform better in the workplace, knowing that they're in a space that is comfortable, a space that promotes health and well-being, a space that is safe for them. So we are about promoting that because then it comes down to better productivity, people feeling more comfortable, better camaraderie and everything in the workplace. So I'm really there and in terms of promotion, bringing awareness and promoting or carrying out any activities that would help people to achieve those different dimensions of wellness.
Let's talk about the actual dimensions of wellness. When you say that, what do you mean? What are they?
These are the different areas of wellness. They're actually interconnected. For example, you have spiritual wellness that helps them to be at peace, reduce stress, and so on. You're looking at physical wellness, which includes things like making sure you get enough physical activity, making sure you have a good nutrition, making sure that you're getting your regular health checks. Then you look at environmental wellness and so on. So all of that ties together in holistically making the person a healthier person.
Good morning. What's your name?
My name is Sheila Grisette. I'm from the Learning and Development, and we are having a HR forum next Friday, and it's focusing on workplace wellness. And we've invited a stress management consultant from the UK to address the forum. So he'll be talking about mental wellness in the workplace as one of the feature presenters next Friday. We've also been working in terms of wellness in the workplace. We've had 2 webinars thus far. In October of last year, we would have had a webinar focusing on suicide awareness. And then in December, we also did the stress management as well. The same presenter who will be at the forum next Friday, will be continuing the presentation in terms of stress management in the workplace. And another initiative that we're working on is development of tips for work-life balance, and that's going to be presented as well at the forum next Friday.
Wow, what has the response been like?
In terms of the webinars, the response was very, very, very good. Persons wanted to engage more, and that's why we invited the presenter, Mr. Chess Moulton, to come again and to present at the forum next Friday.
Thank you very much. All righty, so Ronnie, we're still talking about the National Workplace Wellness Policy, and if you are interested, this is the road runner for you. We are continuing, staying in the Warrens area. This is Warrens Tower number 2, but we're heading over to H&B Hardware. To that person who just joined us right here on VOB 92.9 FM, what are we talking about today? This workplace wellness policy, a national one, and the importance of it.
Okay, so Carol, we have some good news. In 2019, the Barbados government, through its cabinet, approved National Workplace Wellness Policy of Barbados. The first ever policy. There's no other jurisdiction on this planet that has a national workplace wellness policy. And the policy is there to promote workplace wellness behaviors across the board, from physical, mental health, environmental, occupational, social wellness. So 9 dimensions of wellness. So what we're doing is embarking on an ongoing educational campaign and promotional program on wellness, educating Barbados.
Let me stop you there, Professor Dwayne Devonish here. I don't want you to go past what you said. Barbados is the first to do something like this. That is huge when you think about it. You know, this little 166 square miles has come up with a national workplace wellness policy that could be adapted by people everywhere.
And it also gives employers an opportunities to raise the morale of their workplaces. And I think I'm looking forward to talking to the private and the public sectors on this important policy. And even when we designed this policy between 2016 and 2019, we wanted that social partnership. We wanted the employers to sit on the same table with the trade unions and government and all agree that we needed this workplace wellness policy. So with that same spirit, we're implementing this policy across the board from civil society to the private sector.
In a few seconds, now you're part of the planning and the pushing. Your role, what are some of the workplace stresses that you face? Because I want to get personal, Professor.
Well, there's several workplace stresses that affect me and I think affect many Barbadians. One of the first is the inability to maintain a work-life balance. You know, that boundary that we normally would have between work and personal life, that almost disappeared in the height of the pandemic. And we're still trying to recover that boundary, that balance between work life and personal life. Another perennial issue that is affecting workers is the increasing workload coupled with the lack of resources. So here you're in a position where you have to push, but you don't have the resources. So as the workload increases and there's little or there's a declining base of resources, it adds to the stress, and not just stress physically but mentally as well.
Okay, so we're going to be hearing more about this very special national policy. Things that you have in place already at H&B Hardware as it relates to safety, keeping your workers safe.
Yes, we have. We try our best to make sure everyone is safe and.
What about attire, things like that, things that you have to wear? Because I know you have a lumber department as well.
Yes, please. In that section, we also make sure our staff have safety boots, gloves, hard hats, spectacles, everything they need to be safe and
Well, everything they need to be safe. Do you ever think about, we're talking about your physical safety there as well. Mr. Boyce, do you ever think about like your well-being when you're at work?
Yes, I would say good morning to the Ministry of Labor, Security, Social Security, and the third sector. Good morning, and the team from Starcom Network, the Roadrunner. Thank you for having us, and we welcome you here to H&B Hardware and Lumber, the helpful place, and we thank you for having us. And in the workplace, I want to say that at first, from the beginning in the morning, a simple speech, good morning, how are you doing? That starts the wellness of the team. And then everybody fall into place. It brightens everyone's day. And then we move from there. And here you can see that we have spacious aisles. The aisles are well lit. And the maids, they have the store well clean. And I want to say a big thank you to Alexandra, Gladys,
Forget what?
Lizanne and Valerie. I want to say thank you for keeping the store clean. Thank you very much. We appreciate that, because that starts the day for us. You come in early and you clean. So that's a very big part of it, when we can lighten up each one another. Thank you very much. And
You know, that's important, Mr. Boyce. Come in here, Professor. He just did something that was really, really special. I mean, we're talking about this, so I want you to introduce them to a bit of even having a supervisor who says, thank you, I appreciate you, job well done. That helps with your mental wellness.
Absolutely. And you know, it is so interesting. I had a class last week and it was saying that, you know, when we try to motivate our workers, we can give them public praise or we can give them private praise. Private praise is when you pull aside a staff member and say, you know what, Barry, you did an excellent job. Those kinds of things raise morale and employees' excitement. So I'm happy that ASHMB is doing just that. Now, the National Workplace Wellness Policy. How many of you know that Barbados has approved a National Workplace Wellness Policy? Any of you? Well,
I guess that's no.
Well, here's the good news. Barbados is the first country ever to have a national workplace wellness policy. And all this policy does is to guide managers, employees on how to take better care of themselves within the workplace. And you've mentioned a lot. You've mentioned about the safety precautions and the activities. You've mentioned the mental health side of things. And the policy cuts across all of those dimensions, even the as you said, the communication, the happiness, that developing that sense of community. So I am looking forward to working with all of you here at HMB to promote wellness.
Thank you so much. This is an exciting opportunity as we witness companies being introduced to this national policy, and not just any national policy, the first anywhere, everywhere everywhere. Okay, so Barbados, we're trendsetters as we've always been. So Ronnie, I'm going to head back to you. We're going to head out to another part of Warrens. We're staying in the Warrens area as we continue to introduce this national workplace wellness policy to Barbados. Thank you very much and welcome back, VOB Country. And we're talking about the National Workplace Wellness Policy. And we're here standing outside the Maria Holder Diabetes Center. And just across from there is the Barbados Red Cross Society, two amazing organizations doing a lot of work. So let's do a quick introduction to the policy. Come on in, come on in. Let me get an introduction first. You are?
I'm Marcia White. I'm the General Manager of the Maria Holder Diabetes Center for the Caribbean and the Barbados Diabetes Foundation.
Fantastic.
Yeah, I'm Dwight. I am the Manager Treasurer at the same organization.
And this is?
I am Danielle Toppin, and I'm the Director General at the Barbados Red Cross Society.
As far as I know, no relationship. No relation. Well, sorry, no relation. We might have a relationship after this because of the amazing work that these two organizations do. Now, given what we're trying to do here and really look at workplace policies and wellness and life and balance, so I'm going to turn over to you as you introduce these two fantastic organizations to this policy. And we know how stressful it can get running organizations like this that are always helping Barbadians. So come in a little closer.
Yes, Carol, and I'm happy to incorporate the civil society or the third sector. As you know, this national workplace wellness policy is not just for the private sector, it's not just for the public service, it's also for the civil society. Now, I would like to hear first, Carol, from the Maria Holder Diabetes Center, the general manager, Ms. White, Mr. Edgel, about some of the work that they have been doing to support wellness in the organization.
No, within our organization, we have staff members who obviously work very hard. We work long hours. We're helping others, and I really do encourage all of my employees to take care of themselves as well. They have to take care of themselves so that they can take care of others. So one of the biggest things that I push within the center is to make sure that they stay hydrated, and we do have a beautiful water cooler system in there that keeps the water clean and cold, and it never runs out. So I'm really always pushing for them to stay hydrated so they have lots of energy, they can focus. Sometimes when people get tired and they have headaches, it's not because there's something wrong with them, besides the fact that maybe they're just not hydrated. So I'm always pushing for that. Also pushing for them to find opportunities to move throughout the day, looking for the stairs and not taking the elevator. That's a big one, and I tease a lot of the staff about that, because we don't always have a chance to go to the gym or have the energy to go to the gym after work. And really going to the gym is an intentional sort of man-made compensation for a sedentary lifestyle that we are all leading. And we have to look for those little opportunities during the day to move. All those cliches about parking further away and walking, all of those activities add up, and they're easy. You just start incorporating them during the day, and then you'll actually be in a better mood as well when you don't find that parking spot that's close to your supermarket or place of work, and you're looking for something further away. It's actually safer for your car, and you don't have the stress of fighting with other people.
All right, so let's head over here. Anything that you have in your organization that looks at wellness?
Well, for us, we think of health and wellness as part of building resilience. Red Cross is really about building individual and community resilience. You can't have a resilient community, resilient society without healthy individuals. So we do first aid training. We're doing training in psychological first aid, which is really, we've been doing that right now with the psychiatric hospital and with Ministry of Labor and Ministry of Public Sector. And it really is also about building self-care tips, because the work that we do, caring work, is very hard on the carers. So just the general attitude of building health as a part of building individual and community wellness. Resilience, that is the Red Cross mandate.
What we're going to do after I want to find out what psychological first aid is. So, Gabby, we're going to take something like that so that we can post, because I am sure lots of ears just went up and they're definitely trying to find out what this is all about. So make sure you look out for that, because I for sure want to find out what it's all about. We have pretty much reached that time where we have to wrap up. So let's do a quick switch out with the team and get our team here that have joined us on the road this morning. Thank you very much. We had Professor Dwayne Devonish. He's a part of the subcommittee organizing all that's happening here. We have Rhonda Farley with the Ministry of Labor, Social Security, and the Third Sector. You see how I remember? Donna here, she's with the Ministry of Health and Wellness, and Shakida with the Barbados Workers Union, making sure that this national policy, which is to deal with workplace wellness, is introduced. And I'm sure, Rhonda, just quick. Oh, we're getting you. We're getting good breeze and beaten up by palm trees. This is going to continue.
Of course. This is the start of our promotions and so on. But definitely this year we'll be reaching out to a lot of the organizations. We just made a start sensitizing persons today, but we'll be reaching out to the Barbados public in general and the business places to continue the promotions on the National Workplace Wellness Policy. We're also asking organizations to look at channeling the Workplace Wellness Policy through their safety and health committees.
All right.
Those are already established by law, so we want to work within that framework to get the policy out there to all staff.
Well, thank you so much to the entire team for joining. Thanks to Daddy Biggs on tech. So everybody say goodbye to VOB. Bye-bye. And back to you, Ronnie, as we look at health and wellness in the workplace.